ending this pandemic. One of the signatories to the letter is Mariana Mazzucato, author and professor in the economics of innovation and public value at University College London. Welcome. Thank you for joining us. Let's talk first of all then about the vaccine and the desire by many for there to be an open patent so that countries can't be prioritised in buying up stocks to get the supplies first and foremost, and that businesses can't effectively capitalise on selling it for higher prices. What do you want to see on that front?
Well, specifically, I mean, we have to be very clear on what the demand is, which is to develop an effective vaccine that can be produced at global scale rapidly and especially made universally available for free. Now, this requires actually enforcing, not making it voluntary, to really make sure that both the patenting, the pricing, and the manufacturing capacity are really designed in such a way that have international collaboration and solidarity rather than competition between countries or pharmaceutical companies at its core. So a public interest-led vaccine. And there's basically three demands in the letter. The first is to ensure a mandatory worldwide sharing of all COVID-19 related knowledge. In other words, in an era where we talk about big data and collective intelligence, this is the moment to walk that talk. And that does have to do with, for example, creating patent pools and really making sure that any knowledge is enforced in terms of the licensing capability so it doesn't remain secret. The second is to establish a global and equitable rapid manufacturing and distribution plan so we can actually make it for everybody around the world. And that really has to be funded fully by rich nations. And third, we have to guarantee that the vaccines, the diagnostics, and the tests are provided for free of charge to everyone. And this means that we really have to prioritize access, especially for frontline workers, the most vulnerable people around the world, and for poor countries with the least capacity to save lives because their health systems are so weak.
Can you enforce that, though? The UK and the United States are being criticised for not wanting that model to go ahead.
So I've actually been arguing for this type of enforcement for a long time, even pre-COVID. And the reason is that we have to understand how innovation in the health sector comes about. And it actually comes about through a massively collective process. It's not true that this is just kind of big pharmaceutical companies expressing their entrepreneurial spirit. There's huge amounts of public funding into drug innovation, into vaccine innovation. And so by not governing that in the public interest, that's a failure of how we innovate itself. And so it's really also about changing the narrative to pretend that this is somehow a market that is being intervened in by public authorities for just causes and that it somehow will maybe hurt innovation. It's, that has been the mantra, in fact, that unfortunately many, not all, large pharmaceutical companies have been arguing for their ability then to price, for example, drugs that do receive a lot of public funding based on whatever the market will bear. And just specifically—
Sorry to interrupt you. I mean, because I hear what you're saying there, but if countries are resistant to joining in this effort, can it happen?
Well, so the effort shouldn't. So the effort is there in terms of it's a global collective effort in terms of the search, the race for this vaccine. What we need is a global collective effort for the governance. And if they're not going to be willing, yes, that will be a massive, huge failure of international collaboration in such a desperate time. And the history books will hopefully write about it so we don't repeat that. Now, what I was saying before, though, is that you do have very large amounts of public money in the US, for example, the National Institutes of Health or the Coalition for Epidemic Preparedness Innovations called CEPI. These organizations are putting huge amounts of money into the search for a vaccine. All we're saying is make sure you also govern that process in the public interest. For too long in the medical sector, even though we have collective efforts around the creation of value, we don't then structure that value so that it really is socialized to meet the needs that people have. And this is also not just related to COVID, but currently we just cannot get this wrong. Too many lives are at stake, especially in countries with weak health systems, but not only. I'm living in London where we know the crisis is huge. And so really working through what does it mean to create patent pools so that we're not allowing the knowledge itself to be harbored in a secret way, which then just fuels temporary monopoly profits. that might be okay for some, specialist drugs for luxury diseases. This is not okay right now. What we really need to make sure is that we have compulsory licenses, we have the patent pools, we increase the capacity for countries to actually then manufacture the vaccine once it's available. And we need international solidarity. This is not a moment to have, survival of the fittest or a competitive model of innovation. It has to be driven by cooperation for the public good.
Thank you very much indeed for joining us, Mariana Mazzucato.